Can you imagine? Now, Lenny's bleeding mostly happens between 2 a.m. and 5 a.m. Now, there have been other cases of people who bleed from the eyes. Lenny's family is aware of those cases, but those people don't have the combination of bruising and bleeding. Also, it seems like the other cases improve with time. In Lenny's case, it just seems to be getting worse.
That is heartbreaking.
Amazing.
Now, although that disorder is rare, there are other bleeding disorders that aren't so rare. In fact, did you know that some over-the-counter medication may be to blame?
So joining us today via Skype to tell us more about it is Dr. Robert Ferber, family medicine physician and hospitalist with the Nanticoke Health Services. Dr. Ferber, thank you so much for joining us.
Thank you for inviting me.
So we're talking about Lenny's case here, and the Diamond-Gardner syndrome is rare. There do seem to be other cases across the nation, though, where people might have one of those symptoms. What causes that?
Well, first of all, let me clarify that I'm certainly not a specialist in blood diseases or hematology. In fact, yesterday when I first heard about this condition, I had never heard of it before. And so I had to do some reading, on the internet like anyone else to find out about it. And I'm certainly sorry to hear that this woman is suffering from this problem. It certainly sounds like a really difficult one. But in any medical situation like this, a physician would, approach it in the same way. We try to take a history of the problem, an examination of the person, and then some detail about their past medical history, perhaps medications that they use. Then, of course, there's laboratory testing. Of course, this condition is so very unusual. It's really hard to say exactly what would be found, although characteristically, nothing is found to explain it, and they're left with the mystery.
Yeah, it certainly is a mystery. Now, there are other bleeding disorders that people can have. What are they?
Well, that's a really big question, but there's all sorts of problems with bleeding that are pretty common in medicine. Some of them, we all are familiar with, people who have frequent nosebleeds or people who bruise easily. But in general, we think of the bleeding problems in two general ways. One are the hereditary conditions, and the other are the acquired conditions. Now, the hereditary ones include such things as classic hemophilia. There's other conditions that don't always appear in childhood like that one does, such as von Willebrand's disease. Many people have never heard of this and hear of it for the first time when they have a tooth pulled and continue to have a lot of problems with bleeding afterwards. So there's a lot of different hereditary causes, but there's an even a larger amount of acquired conditions. For example, I'm sure you're aware of people who are quite a bit older who have very fragile skin and get easily bruised with minor injury. And this is really part of aging for those people. And of course, then there's some very, very serious problems that can occur as well.
I think almost all of us take over-the-counter medications for like headaches or maybe other ailments, but these can actually cause internal bleeding?
I'm really glad you asked that question. I think a lot of people don't realize this. Probably one of the most common medicines taken is aspirin. And aspirin is specifically used for its ability to inhibit bleeding in the normal person. But not only can it lead to bleeding, but it can even cause ulcers, which can be pretty significant. Some other common over-the-counter medicines include the arthritis medicines, such as ibuprofen or naproxen. These too can cause ulcers as well as promote bleeding. It's also important to realize that some of the supplements that people take can influence it. Such things as fish oil, which a lot of people take, can make bleeding a little bit more likely. And there's even some herbal supplements that can lead to it as well.
Wow, I didn't know about that,
Yeah.
especially the fish oil. Okay, so are there some signs or symptoms that we can look for
Sure.
internal bleeding?
Well, there's obviously the ones such as Lenny has, which is, really quite evident when you, wake up and have blood on your pillow. But sometimes it can be more subtle. For example, modest amounts of blood in the urine tends to give the urine a tea color, very much like iced tea color. And a lot of people wouldn't recognize that as blood, which could indeed be, a marker for a serious kidney problem. Similarly, if a person has a bleeding ulcer, the blood becomes digested in smaller quantities and can lead to your stool becoming tarry and very black in color. And a lot of people, of course, would not recognize that as digested blood. But those are the kinds of things your doctor would certainly ask about.
Dr. Ferber, just because we bruise easily, that doesn't necessarily mean we have a bleeding disorder, right?
Well, it's certainly a good thing, because I think all of us find bruises on ourselves and wonder where they came from. I think that, the occasional bruise, the occasional nosebleed doesn't necessarily mean much of anything. But if it were frequent and extensive, certainly it would be worth bringing up to your doctor.
All right.
Dr. Robert Farber with Nanticoke, thank you so much. Appreciate your time with us today.
Thank you.
And to read more about these different bleeding disorders, go to WBOC.com, click on our picture at the top of the page. We talked about mysterious conditions